Go. Okay, good.
All right, so recording has now started, and there will be a slide about the recording in a minute. The other members of the review committee are on. The purpose of today's meeting is to discuss the new reporting requirements that are coming into force on November 1st, 2018. We have members from each of the regulatory colleges here. We intend to start with a short presentation which will outline the current state and the reporting arrangements that have been put in place, and then we will open the lines and people will be able to ask questions. I would suggest that you identify your profession when you ask your question so we know where to direct the question. If you are more comfortable with putting your question into the chat box, please feel free to do so, and we will follow that. Melanie, I can't actually see it when I'm presenting, so you'll have to monitor that if you don't mind.
Will do.
So I've introduced myself. I'm just going to go down the list as it appears on my screen. So Deborah, do you want to introduce yourself, please? And you're probably on mute, it looks like. Okay. Alberta Health. Are they not able either? Should be. Greg, can you introduce yourself?
Good morning, it's Greg Eberhardt, Registrar, Alberta College of Pharmacists in Edmonton.
Thank you very much. And Scott? Maybe not. Troy, can you introduce yourself?
Hi everyone, my name is Troy Stuke. I'm the public member on the Regulatory Review Committee, and my mom had an assisted death in April 2017.
Thank you very much, Troy. I'm not sure why we're not hearing from the others. Alberta Health, are you able to talk to us? All right, I'm not sure quite why that's happening, but the other members of the committee, Deborah Allen is from CARNA, representing the nurse practitioners. Scott McLeod is from CPSA, physician, and Alberta Health are also on the line. It may be an issue with the way the mute is working for some reason, and once we unmute the lines, then hopefully they'll be able to speak. So yes, Doug, the audience is muted because we are recording, and I'm going to jump into the presentation. There we go. Scott, I had actually made you a presenter, so you should be able to be unmuted, but I'm not sure what's happened there. It worked for some of the others, but it didn't work for you and Greg, and or you and Deborah and AHS, I guess. All right, so can everybody see the screen? Melanie? Okay, thank you.
Yes, we're good.
All right, so as I said, we are going to talk about the new reporting requirements for medical assistance in dying. It's important to note that the information is current as of the date of this presentation, which is October 25, 2018. It is subject to change if things change in the future. I also am required to identify that the lecture is being recorded in video format by AHS. The recording may be used and disclosed by AHS for educational purposes and may be further broadcast by AHS for other presentations, publications, or promotions. This may include conversion to digital format, storing, and publication on AHS webcasting technology. It says anybody who doesn't wish to appear in the recording should move out of range. We are not recording any individuals because we are only recording the Skype itself, and it will be available after this presentation as a webinar for information purposes. So here is the overview of what we're intending to do. We'll talk a little bit about the background and the reporting process. We'll talk a bit about the forms and the processes we put in place here in Alberta, and then we'll get into some discussion. So, the background is federal regulations were put in place to establish a monitoring regime for medical assistance in dying. These came about as part of the legislation that legalized assisted death in the first place. And as it says on the right-hand side of the screen, the regulations were published in the Canada Gazette on August the 8th, 2018, and they are publicly available for review. The regulations address what information must be provided, how and when it must be provided, to whom, and its use and disposal. It will be used to publish an annual report on Made in Canada that will include a number of things such as the number of requests received, the number of medically assisted deaths that occur, and the number of people found ineligible. It will also include other information about the characteristics of the individuals who are seeking an assisted death, which the government have indicated will be published in aggregate form annually. In Alberta, we have the MAID Regulatory Review Committee. Alberta Health Services will act on behalf of the review committee in terms of collecting the data and collating it under the ministerial order which has been provided within the prescribed timeframes within the legislation. Somebody can't hear. Can others hear?
I can hear you perfectly
Okay.
fine, Jim. Yeah.
Okay. Oh, some people can't hear. Okay.
We have a mix, it seems.
I'm not sure why. Well, all right. You know, maybe what I will do, in case it's a muting issue, is I will unmute the audience. But please, 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 anybody who is on the line, mute your line. We've had lots of difficulty with audience noise that has actually obscured presentations recently. So we'll see if we can do this. All right. Don't know whether that's going to help, but hopefully. So in terms of roles and responsibilities, the Federal Minister of Health is responsible for making the regulations to establish a national monitoring regime. They made provision within those regulations. Somebody's not muted and I'm getting an echo, I'm afraid. And within that provision, the Minister of Health has been identified as the designated recipient in Alberta who is responsible for data collection pursuant to the requirements of the Criminal Code. As the designated recipient, Alberta Health will be collecting, so AHS on behalf of Alberta Health will be collecting the information and will be providing from Alberta Health to Health Canada. However, there are certain components of what will be collected that will not be provided to Health Canada, and as it says on the slide, it is not required for Alberta Health to provide the name of the practitioner or pharmacist or the mailing address and email address that the practitioner or pharmacist uses for work to Health Canada. We are still required to collect this information because if there are issues with the data that is being provided, we have to have the ability to go back and clarify, and that will require having some contact information. So it will be collected up front, but it will not be being provided to Health Canada. Sorry, something's frozen here. Oh, here we go. In Alberta, the AHS Care Coordination Service will be the point of contact for all reporting in Alberta. The work will be carried out on behalf of the Regulatory Review Committee and the Minister of Health. And practitioners are strongly encouraged to contact the Care Coordination Service for direction in terms of the reporting forms and the requirements for when to report if there is any uncertainty. So, for those of you who aren't familiar, within Alberta, we have the Care Coordination Service. This is a group of individuals across the province who are available to support patients, families, and care teams through the process. This is not a provisioning service. It acts as a central coordinating body and navigates the system with individuals and their families who are seeking an assisted death. So the Care Coordination Service is able to find access to resources, consultants, transfers if that's required, the forms that may be required, information for individuals and practitioners, pharmacists, and so on. And the intent is that they will the Care Coordination Service will be in a position to guide anybody who is involved in the process of assessing or providing an assisted death, or or patients who are seeking an assisted death, with the support to work their way through the process, and as it says, also assisting in data collection. So, when is a report required? A report is required when a physician or a nurse practitioner receives a written request for MAID in most cases. And any written request that's asking for a provision of MAID can trigger the reporting, but it has to be in writing. It can be in any form. It is an explicit request, and it originates with the patient. And reporting for pharmacists is required when a pharmacist dispenses a substance for the purpose of MAID. So, if you look on the right-hand side of the slide, the written request, as it says, yes, if a practitioner receives a written request through the Care Coordination Service or a referral. Yes, if a patient who is unable to speak writes a request down on paper and hands it to the practitioner. Yes, if a practitioner receives an unsigned request from a patient through an email or a text message. No, if a patient meets with the practitioner and asks for MAID but does not put their request in writing. No, if they email a practitioner a list of questions about MAID to understand what's required to qualify. And no, if the patient types a request for MAID into a speech-generating device in the presence of a practitioner. So it is a written request. So in terms of when a report is not required, if you receive a written request, you only provide the contact information for the Care Coordination Service. We're not further involved in the MAID process, and we're not aware of any other outcomes happening to the individual within the 90 calendar days of receiving the request. You do not require a report. And you also do not require a report if you've already filed a report related to a written request but have not provided MAID yourself. So to clarify, if there's an initial patient inquiry, the written request can be received in any form, as long as it's in writing, and reporting is required even if the request is not signed or dated. If there is a referral or transfer of care, we've had discussion with Health Canada about how this is defined. Referral or transfer of care occurs when a practitioner directly contacts the Care Coordination Service or another practitioner to refer a patient for MAID. But providing a patient with contact information for the Care Coordination Service is not a referral for the purposes of the federal regulations. So, as we have said earlier, within Alberta, a referral is not required for medical assistance in dying. The Care Coordination Service is accessible, and a patient can contact directly if the patient has the information for the Care Coordination Service provided, but the practitioner is not doing anything else actively to connect the patient with the Care Coordination Service. This is not considered a referral for reporting purposes. The 10-day waiting period is the other piece where we have had questions. In calculating the 10 clear days, the day on which the request was signed and the day on which MAID was provided are not included. So it has to be days in between those two. And clear days include weekends. As you know from the legislation, a shorter period is permitted where assessors agree that either death or loss of capacity is imminent. And these are the federal timelines for reporting. If you do not provide MAID, but you refer a patient or transfer care as a result of the request, the report is required within 30 days after the referral is made. If you find a patient to be ineligible for MAID, reporting is required within 30 days after the day the ineligibility is determined. If you become aware that a patient has withdrawn the request from aid, the report is required within 30 days after the day you became aware of the withdrawal. And if you became aware of patient's death from a cause other than MAID, the report is required within 30 days after the day you became aware of the patient's death. Because we have the Care Coordination Service in Alberta, individuals who withdraw will likely be known to the Care Coordination Service, assuming that the Care Coordination Service is involved, which, as I say, we strongly encourage, in which case the reporting can be done through the Care Coordination Service mechanisms that are already in place to identify the withdrawal. Certainly, we do not always become aware of a patient's death from a cause other than MAID, and in those circumstances, a practitioner who becomes aware will need to identify that and report it. If you provide MAID, then of course reporting is always required. If you provide where the substance is actually administered to the patient, it's required within 30 days. We encourage that, in fact, the reporting occur much sooner than that because we have to get the data together to forward to Health Canada. If you are prescribing a substance for self-administration by the patient, the report is required between days 90 and 120 after the day that the prescribing occurred. However, you can report earlier if you know the patient has died. And in Alberta, we've not actually had any self-administrations to this point. In Alberta, there will be a document. This is what the document looks like that identifies the reporting process. It steps through the various things that are required. It includes, as you can see, in step 1 that is the request. Step 2 is the eligibility assessment. Step 3 is the referral if a referral is made. Step 4 is the mandatory period of reflection during which a number of things can happen. Step 5 is the provision of MAID. And what we have tried to do is develop an easy-to-use sheet that identifies when reporting is or is not required. So the specifics for Alberta are identified on this sheet, which will be available posted on the website. Forms. There are a number of forms associated with reporting. There is a physician nurse practitioner form which will be available through Service Alberta. It must be filled out when a physician or nurse practitioner refers a patient to the Care Coordination Service or other practitioner using the definitions of referral that are earlier in the presentation. The form is not required if a patient contacts the Care Coordination Service directly. So if you have a patient who has contacted the Care Coordination Service, you are not actually required to complete the form through Service Alberta, but it would be important to be guided by the Care Coordination Service in terms of what accountabilities there may be depending on the role that you subsequently may or may not play. There are some components to the form that require some explanation. One is that under the new reporting requirements, we are required to identify disability support services. We have had conversations with Health Canada to better understand what this means, and what they have clarified is that it does not include unpaid care, it includes paid care. It could include assistive technologies, adaptive equipment, rehab services, personal care services, and disability-based income supplements. We asked about things such as canes and walkers, and the response to us has been that some discretion will be required. The intent is to try to get a sense of as to how disabled an individual may be prior to their request for an assisted death. If services are delivered by care providers such as physical therapists, occupational therapists, personal support workers through home care, for example, that is required in terms of identifying the disability support services. The other clarification from Health Canada has been that you can only report what you actually know, and therefore if you are unclear as to whether or not an individual has certain services, you would not necessarily report those unless you know that they are services being received. There is another component to the reporting which talks about the patient's description of suffering. There is a requirement to provide the description of suffering, and there is a list that has been provided. There has been lots of discussion about the list. The list is not intended to validate or invalidate forms of suffering in respect of eligibility for MAID, and that's an important point when you see the list if you have not already seen it. It is intended to support practitioners in relaying the patient's description of their suffering, and one of the reasons for putting the list in was to try to get some consistency in terms of description across the country. There is a sex or gender box on the form. The form allows for reporting as male, female, or other. There is a dialog box for supplementary information if other is chosen. Palliative care, if known that if an individual was receiving palliative care services, if they were either offered or received, that needs to be reported. One of the things that is included in that is duration of receipt of palliative care services, if known. So in that particular instance, it would be the best estimate of the individual as to how long an individual had been receiving palliative care services. There is a list for physicians under 1B, which is practitioner information. It is not an exhaustive list. It is a list of designations for different practitioners, different physician practitioners. If a practitioner who is not within one of those categories is involved in either assessing or provision, then there is an other option. Health Canada have indicated that based on the responses that they get in the first round of reporting, they will look at the list and it may change in time. The characterization of illness, disease, or disability is a section that is also included. There are a number of questions related to that. There has been there have been discussions about privacy concerns. We have actually undertaken a fairly rigorous process within AHS and subsequently as well within AH, looking at the requirements that will protect the privacy of individuals in the information exchanges that will occur. And much of that has been completed in the background. The Office of the Privacy Commissioner is actually reviewing it in order to ensure that we have adequately addressed all of the issues that we would reasonably consider to be potential issues around privacy concerns. And as noted earlier in the presentation, the identity of the practitioner and their contact information will only reside within Alberta. It will not be shared with the federal government. There is also an issue of burden on practitioners. We recognize that reporting is going to add some additional workload. We have had some discussions and we have looked at mechanisms to try to mitigate that to a certain extent. And one of the reasons for encouraging that the Care Coordination Service be contacted is that they will be able to direct practitioners to the most expeditious form of reporting for the particular circumstances of that practitioner. So within Alberta Health Service, we have done some things that we're hoping will make the whole process easier. The record of request form, which is an Alberta Health form through Service Alberta, will continue to be used. It has been modified so that it includes information that's required for the individual. It also includes a statement that will identify to the individual filling out the form that the information will be shared federally under the requirements of the legislation. We have been working for some time to develop a practitioner assessment form. There have been versions of this that have been used through the Care Coordination Service. We have modified the practitioner assessment form now, and it contains all the required information for reporting where an individual is found to be ineligible, which is the requirement. If a practitioner uses the assessment form and completes all of the fields in their assessment of the individual, they will not be required to additionally complete a separate reporting form because we will have all the information required through that combined form. It is a clinical form that has had the reporting requirements inserted into it. It makes it a little bit more cumbersome. We fully appreciate that, but we felt it was an option we ought to offer rather than have an assessment form that has to be done, and subsequently a full reporting form that had to be done. So we will be interested in the feedback that people who use the form have on it as the process unfolds. In addition, the providing practitioner record is a form that has been available through Alberta Health and through Service Alberta. Again, we are in the process of revising the practitioner form, looking at it from the same perspective as the assessor form, and if we are able to complete the agreements around the practitioner record, it will contain the required information for reporting again. It should not say where an individual is found to be ineligible. That's an error on the slide. If you are providing, you are providing. Therefore, it will contain all required information for reporting the MAID event itself. So the thinking here, as I say, has been we've tried to take some clinical forms, include the reporting requirements within them, and if they are used, and the providing practitioner record is actually required by the Office of the Chief Medical Examiner, but if the forms are used, then the reporting will not be required to be done on a separate form because we will already have the information. The recipient of the forms is the AHS Care Coordination Service, and my office, the provincial office. We will collect and collate the information for transmission to the Minister and to Health Canada subsequently. We will also assist practitioners with identifying the reporting requirements and forms where they are involved in the process. There is a pharmacist form. The pharmacist form is somewhat simpler. It includes the health insurance number, the pharmacist place of work mailing address, the pharmacist email address, and an other option for where was the substance dispensed. Hospital and community pharmacy are the two other options. We have had discussion with Health Canada. They are going to monitor whether or not the other option is required, and it may or may not be there in the future, but at this point, if the individual is receiving a dispense that is not from a hospital pharmacy or a community pharmacy, I'm not sure what that might be, then the other option is available to use. So that took a little longer than I had anticipated, but that is the gist of the reporting. I am going to put up the next slide, which has all of the contacts on it. We have created a new email address for questions regarding reporting. It is MAID reporting, no dot, MAID reporting at ahs.ca. We have also put in place a mechanism for submitting forms via WriteFax. The number is on the screen, and we have WriteFax numbers now for each of the care coordination services, one in Edmonton and North, one in Calgary and Central, and one in South, and the numbers for all of them are on the screen. The MAID.care team at AHSCA email continues to be active and is the primary mechanism whereby many of our contacts occur. And we will continue to have the website, which we will update with information as it becomes available. So with that, I will turn it over to the other members of the Regulatory Review Committee, if any of the others of you have comments before we open for questions.
Jim, it's Greg Eberhardt here. For the pharmacists participating, I'd just like to add emphasis that when reporting, you will not necessarily be reporting the location at which you dispense the drugs. What is required is the reporting of the location where you most frequently work or most frequently practice. And again, the request is for your most frequently used email address, whether that is the one that you use at your practice site or not.
Thanks, Greg. Any other comments from members of the review committee? All right. So we have some questions that are starting to appear in the chat box. Are practitioners now to fax the ME and the WriteFax? And the answer to that is yes. That came from Joe. And the cover sheets for the ME will be modified to include the numbers for each of the care coordination services. There was a question as to whether or not, I have to go back up, sorry. Where is it? Forms can be scanned and emailed. The problem with that is that forms actually need to be faxed. Otherwise, we have to have an encrypted email in order to ensure the security of the data. And that becomes a challenge we have found with the systems that are out there. And therefore, faxing is the preferred mechanism because WriteFax is a secure fax. Another question, if the patient is scheduled for MAID provision through the care coordination service but dies of underlying cause prior to date, can that non-MAID care coordination service attending team assume that the MAID care coordination service team will report this, or should the attending physician call the CCS to confirm that CCS is aware of this death and will report? We have had discussions about that in terms of trying to ensure the simplicity of the process. The issue may be that the care coordination service will not become aware of the death because there are periods of time in the process where there's not a lot of communication. For a variety of reasons, the patient may have chosen to delay their provision, for example, and so we may not have a lot of contact in that time frame. I think that for our purposes, it would actually be simplest if the care coordination service was contacted, or actually if an email was sent through MAID reporting to identify that the individual has died and when and from what, and then we can look after the reporting from there. In pharmacy, would we be referring the patient to their doctor or to care coordination to start the process? I think, oh, sorry, Scott. I'm not sure that everybody's unmuted, so I'm not sure what the problem is.
Can you hear me now?
Yes.
Okay, I've been playing around with my mic here. It doesn't seem to be working properly, but I seem to be on now.
Okay. Did you have a comment, or you were just trying to get in?
Just trying to get in. Sorry about
Okay.
that, Jim.
Thanks. In pharmacy, would we be referring the patient to their doctor or to care coordination to start the process? It could actually be either, because the individual, an individual who comes in, assuming they've made, oh, somebody's not muted, assuming they've made a request or are asking about a request, could actually go through either route if they are comfortable to have the conversation with their physician. That seems to me to be the appropriate, or nurse practitioner rather, that seems to be, to me, to be the most appropriate. First step, if they are not comfortable, then they could contact the care coordination service directly. We have another question. What is the definition of palliative care service? A physician or NP could be providing informal but effective palliative care. That's one I don't know, that I might have to toss over to Alberta Health to see whether we've had anything further in terms of conversation about that definition. I don't recall one. Is somebody on from Alberta Health? Can you? Nope. Sounds like we're not able to. If somebody from Alberta Health is on and is able to put a response in the chat box, if we can't hear you, that would be great. Is scanning and emailing from an AHS email secure? Yes, it is actually. As long as it's within AHS, yes, it is. It's within the firewall. Pharmacy. To clarify, the pharmacist dispensing the kit to the providing physician completes the reporting form. If another AHS pharmacy manufactures the kits, they are not required to report. Correct?
No.
That's right. It would be the pharmacist who's doing the dispensing. That's right. Does this need to report any written request apply to all practitioners in Alberta? Yes, it does. So all physicians and NPs who receive a written request will be required to report unless Your only action is to provide the information to the care coordination for the care coordination service to the patient, and you're not taking any further action yourself. If you make a referral, so if you actually follow a process and make a referral either to the care coordination service or to another practitioner, you would be required to report. But if you are following the college standard of practice and you are an objector and you do not do anything other than provide that care coordination service information, you are not required.
Jim, there's a question that came to me via email, and it says, what about patient privacy? Will their names be given to Health Canada?
So the short answer is yes, they will. No, wait a minute. What are we providing to Health Canada? We are providing their birth date and their
primary health care number.
Right, correct, sorry. Yes.
And their postal code.
And postal code, that's right. We are not providing their names, no.
Jim, it's Dion. Can I add about the palliative care? So I just pulled
Sure.
up that presentation from Health Canada. It said care may be provided in any setting by specialists or by others trained in a palliative care approach.
Okay, thank you. And Health Canada will be releasing more information publicly about a lot of this by November 1st. But it has been a bit of a work in progress, so thank you for that, Dion. I had missed that. The next question, is there a process for informing healthcare providers involved as to what they are dispensing? For example, in a pharmacy setting, will it be a requirement to inform staff who would be involved in dispensing, checking, filling that they are being involved in MAID to allow people to deny being involved due to moral and religious reasons? One of the requirements within the federal legislation and also identified on the provisioning reporting form, the provisioning component of the reporting form, whether that's the AHS form or the Alberta Health form. I shouldn't say AHS form. The current form is not AHS. Does have a box that indicates that the pharmacist was informed as to the nature of the use of the drugs. And the intent of doing that was indeed to allow individuals who had an objection to not participate in the process. The next question, does disability support services apply when a patient is in hospital or hospice? And I think what they're trying to get at, as I say, is how disabled the individual is because of their circumstance. And so if an individual is in hospice, but it's a hospice service provided to assist them with the various measures that are required prior to their death for comfort, symptom control, and that kind of thing, to me, this is my own interpretation, that's not a disability support per se, that's palliative care. On the other hand, if they are if they have been in hospital, they have been quite disabled, if they have been receiving services, they make a decision to seek an assisted death, whether or not they have continued with those services, it seems to me that would be reportable. But as Health Canada have indicated, there is going to be some judgment required for this, and they are going to relook at it once they start to see some of the data and what it may look like to help further define. The next question, will communication be available to send out to practitioners about the updates with updated forms? Yes. And the intent is those forms will be available on a website, whether it's through Alberta Health or whether it's through AHS. There's a further response on palliative care from Alberta Health. Regarding palliative care, AH has not had any updates from Health Canada. Health Canada acknowledges that services will be defined differently across Canada. To date, there has not been real clarification, though I think, Dion, what you have provided will be helpful in terms of individuals trying to identify what they do or don't need to report. When do these new regulations take effect? Next Thursday. So November 1st, However, anybody who is in process as of November 1st is not required to be included in the reporting. The reporting will start with anybody who provides their written request initially from November 1st onwards. So, was anyone who actually provides MAID involved in the creation of these forms and discussion of the burden placed on providers by these federal requirements and the anticipated attrition of providers likely to result? I don't know, because Health Canada haven't, at least I'm not aware from Health Canada who was involved in the creation of their reporting requirements. We have worked in Alberta to try to, as I say, incorporate the reporting requirements into the forms that we have been using in order to minimize the burden, although we do recognize that there are some additional questions that were not present on the forms that we have had already. And I think there has been a lot of discussion across the country around the burden placed on providers by the requirements, and the fact that providers may and assessors may, in fact, decide that it's too much work. As we have tried to be mindful of that in Alberta, we've taken steps to attempt to put in place what we're doing to mitigate that. And I mean, only time, frankly, is going to tell whether or not we have been successful. When the forms are available and as they are used, if there are issues with them that would actually make it easier for providers or assessors, we absolutely will be open to review and evolution of those forms as we are able to do, but recognizing that we are fully constrained by the reporting requirements in the federal regulations, which are under the criminal code.
Jim, can I ask if you can mute Scott's phone? Because I think it's Scott's phone that's causing the feedback issues.
You can probably do it.
It won't let me. I tried.
Did you?
Mm-hmm.
I've shut my phone off completely.
It's not him then.
Oh.
All right. Next, what are the record-keeping requirements if a text message is received? So I don't actually know the answer to that, because it is considered by Health Canada to be a written request and a valid form of a written request. I would assume that there would have to be documentation that it has been received. You can print text messages, I guess. There are workarounds to do that. And so I presume that that would be one of the mechanisms to use, but I don't actually know the answer to that one. Has Health Canada specified exactly which medications are to be used, dosages per weight, etc., maybe some sort of chart, or is this left up to the physician? So they have not specified the medications, but we have worked in Alberta to provide a standardized medication protocol that is available to all pharmacists, nurse practitioners, and physicians, and it does specify the medications, including the doses and all the rest of it. Will the data that is accumulated be made available to practitioners and to the public? So the short answer is that at an individual level, no. The data will only be used at an aggregate level by Health Canada to report across the country. We have, as you know, been publishing monthly statistics here in Alberta. That practice won't change at this point. But we only provide certain
Hi, everybody. I'm not sure why we lost Jim. It looks like it suddenly went muted. I'm trying to unmute him, and hopefully Jim can hear me and unmute himself if I can't.
I got muted.
Okay, yeah, no, I'm not sure what happened.
So I'm going to go back, and I've unmuted Deborah as well. Where were we? Did you hear the response about emotional support?
No, we did not.
Okay. Will there be emotional support services for providers who may experience unforeseen emotional distress after providing MAID was the question. And so we do have within AHS the Employee Family Assistance program, and within the Alberta Medical Association we have the Physician Family Support program, both of which are available if individuals are affiliated with AHS or with AMA. I don't know whether or not Karna has something similar for the nurse practitioners. And Deborah, if you are on and can enlighten us, that would be great.
She may be muted, Jim.
I unmuted her.
Okay.
Can you?
Yep.
Can you hear me now?
Yep.
No, there. Oh, incredible feedback.
Well, if people have called in via the phone and connected via the computer, it will feed back with each other. So that may be the case.
So now we can't hear you, Deborah.
Okay, I've turned my phone off. Hopefully that will help.
Yeah,
that's better.
Thank you. There is nothing specific at Karna at this time, but it's certainly something that I will bring back to within the organization for further discussion.
Right. Okay. The next, can these slides be shared with my colleagues, or should I wait for new documents to appear on the website? Yes, the slides are fully shareable. And they will be posted on the website. We have a little glitch with our comms folks right this minute, but they will be posted fairly shortly. Lee's comment, aren't text messages considered not to be secure? Shouldn't all patient information be sent via other secure ways? I would think that that would be the case, yes. However, Health Canada have explicitly stipulated that a text message is considered a valid written request. So we're kind of caught on that one, I'm afraid. Let's see. Can someone send me a copy of the information slides, because no amount of installing the software seems to display the slide? Oh, yes. So they were included in the invite for the meeting. Melanie sent that out this morning.
I also sent it out via email.
Okay,
to
so
everybody
it has
that
gone out.
RSVP'd. Yes.
So everybody who's RSVP'd should have it. Okay, I'll get to the second one below it first. And the nurse practitioners can access the AHS Employee Family Assistance Program. Yes, that's actually true. Although, if we had community nurse practitioners who were not part of AHS or not working within AHS structures, then that would be a gap, I think. Is the pharmacist form currently available at AHSCA MAID? No, none of the forms are available. We have been working to get them finalized. They will be available by November 1st. So by the time they are required, they will be available. But there's still been a fair amount of discussion going back and forth. A response about the text messages. Health Canada from Matt at Alberta Health. Health Canada has not been clear on their expectation on the receipt of text messages when we've attempted to discuss security issues and privacy issues around text messages and emails. No clarity has been given. So at this point, though, given that the information we have from Health Canada is that text messages and emails are considered to be written communications, I think we have no choice but to treat them as such. Recognizing that there is potentially a security issue there. Just to clarify, pharmacists providing medications for MAID only fill out form after the MAID has been provided. No, the pharmacist providing medications for MAID would fill out the form when they are dispensed. So if you do a dispense, then you would be required to fill out a form. So, for example, with the oral, you may not actually know when the individual takes it, of course, because they may not take it right away. And that's why I think fixing it as when it was dispensed at least keeps track of what's happening. Can you share where on the Health Canada website it says text messages are valid? The answer to that is that that has come about through the discussions with Health Canada. My understanding is that they will be publishing more information about the regulations and the clarifications in the very near term. And the anticipation is that that information will be available by November 1st. We have been told in our communications with Health Canada that text messages are a valid written request. Doug, does CPSA have advice on any text message communication between physician and patient? I don't know, Scott, if you have a comment about that.
Yeah, I can jump in here. So the reality is that there are going to be patients that are going to use text message to notify you, and that's where that recognition of a text message counts as an initiation. But what we would do is discourage you from having an ongoing conversation about that subject through text message. So it would be a redirect them to either having an appointment face-to-face or calling the person to be able to have a broader conversation on it. So we're not going to come after somebody if a patient writes to you on text message and puts in a request. It's just that we would encourage you to then transition that conversation into a much more secure way.
Scott, Doug here. So is that general advice for communication between physicians and patients via text messaging? Yeah. Is there a practice or advice or whatever you?
Yeah, it's just unrealistic to expect that text messaging is going to disappear in this time.
Yeah.
We know that patients are going to reach out to physicians in that way. So I recommend that, you can initiate a conversation, but don't use it for ongoing care, communication of lab values, communication of results from other investigations and so forth. It's really just a means of potentially initiating contact, but then ensure follow-up is in a more secure manner.
We have a couple of others here. We have, and I know we are almost out of time, so I'm going to be a little selective. There are a couple of messages back and forth about the Employee Family Assistance Program. Melanie, I think it would be worthwhile connecting with Dora after the webinar and having a conversation in the near future.
I've noted it.
Thank you. Is all MAID reporting to go to the fax number regardless of zone split above under care coordination service? The answer to that is yes, because the reporting that will be done, the data entry for that will not be the responsibility of the care coordinators, and we are going to organize for it to be done centrally, so the reporting will all go to one number. Is any deviation allowed from the provincially published oral and IV medication regimen other than the optional narcotics currently allowed? The answer to that is no. Under the ministerial order, the minister has directed that Alberta Health Services and the Care Coordination Service will publish a medication protocol that will be the required protocol in Alberta. Comment about text messages. Yes. Okay. So Matt from Alberta Health regarding text messages, we can share the slides from Health Canada where they explicitly outline the requirement. And probably the last one we're going to have time for. When giving out the oral medications, how are we ensuring that these medications are not being used illicitly? Example, murder, other people in the household having access and committing suicide, children, teenagers having access. Is there requirement for them to be locked up at home? We actually have identified within the work in Alberta so far a chain of custody, if you like, with the drugs. And because the drugs are not provided in powder form, they're actually provided in a made-up form, the expectation that we have is that the practitioner will take the drugs to the individual and the individual will take them while the practitioner is there. We have that as an expectation. We do not have that in requirement in legislation or regulation. And so we are fortunate, perhaps, that we have not had any orals to this point. However, we recognize that this is something that, as time goes by, is going to become more likely, and we may need to re-look at the expectation becoming something more formal if it looks like the oral route is going to become more popular. And the Regulatory Review Committee has had some discussions about this. We are acutely aware of the issues that you have raised. It is 8 o'clock. Oh, most recent recipe for the oral compound is dispensed in powder form. Forget that then. So it is something of which we are aware. The final question, do you anticipate any further education training for providers in the near future? Physicians and nurse practitioners, we would again simply encourage at this stage that the Care Coordination Service be contacted who can help guide practitioners through the process. There will be additional supports that will be coming through the system in the very near future, but we are still working on trying to get them all together, to be quite honest. Some of that is because this has been a bit of a moving target and we have had different information that has come about in terms of clarification from Health Canada, even up to as recently as within the last few days. So I will have to end it there. If anybody had questions that you were not able to ask, please email on the MAID reporting line, and we will ensure that we get responses to you. Thank you very much, and have a good rest of the day. Oh, it's on the last slide of the slide deck. MAID reporting at ahs.ca. There's no dot in it, so it's MAID reporting, all one word, at ahs.ca. Thank you.